Welcome. This video is designed to introduce you to the various types of venous access devices you will be seeing in your clinicals. However, please note that this is not a substitute for class lectures or your texts. Additionally, we will also demonstrate how you should flush a central line and change its dressing. Let's begin. There are three types of venous access devices that we will be looking at today. First, we will look at peripheral insertion devices, then intermediate infusion devices, and finally, central venous access devices. One of the most commonly used PIDs are winged infusion needles. They are usually for short-term therapy or if you're going to use it on a child or an infant. Intermittent infusion devices are also known as saline or heparin locks. They are used when the patient needs solutions or medications from time to time. So it keeps a venous access open without needing a continuous infusion. But remember, it must be irrigated with at least 1 to 3 milliliters of saline to prevent clots. CVAs are usually used when peripheral vein access is not available, or when long-term therapy is anticipated. Additionally, they may be used because the medications are irritating and there is a need for TPN. CVAs can fall into 4 categories, which we will be looking at briefly. This is a picture of a multi-lumen cath, but they can also come in single form. They are the most common, and they're placed into the superior vena cava or the right atrium. They also allow monitoring of central venous pressure. They permit simultaneous infusions, they're used for short-term therapy, and they should only be used in the hospital, so the patients cannot go home with them. This picture is an example of a tunneled cath. There are a few brands out there, but the most common one is the Hickman. These are used if long-term therapy is needed, either continuously or occasionally. You will notice that these types of catheters have what is called a Dacron cuff, used for stabilizing the cath and decreasing infection incidence. Eventually, the tissue will grow around the cuff to secure it in place. Periodic heparin flushing is needed to maintain patency. However, you must look at the brand for they may have different requirements. PICCs are long-line catheters inserted in the antecubital area and advanced into the central vessel. They are placed peripherally, but deliver medications and solutions centrally. These can also be used for long-term or intermediate therapy at the hospital or at home. Implanted access devices are actually located within the chest. There is no catheter protruding from the skin, and these are usually used for cancer patients. This concludes this portion of the video. You will now watch 2 videos on how to flush a central line and properly change the dressing.
Hi, I'm Amanda. I'm a nursing student, and I'm going to show you how to flush a central line. What you need to flush a central line is normal saline, heparin at 100 units per milliliter, alcohol swabs, and gloves. And the reason we flush a central line is to ensure that it doesn't become occluded with any fibrin sheaths or clots. Usually hospital protocol dictates that we flush the line every 8 hours. However, you should check with your institution to be sure. So we start by washing our hands and introducing ourselves to the patient. Hello, Mr. Smith. I'm Amanda. I'm going to flush your central line this morning. So we move his gown down and put on our gloves. So we want to make sure that his line is clamped with this blue clamp, and we remove the cap from the line. And we're going to use an alcohol swab to sterilize the cap or the line. We flush with 3 to 5 milliliters of normal saline. Make sure you unclamp the line first. Some hospitals call for the pulse pause technique, where you pulse the saline and then apply the clamp while you're pulsing, and this helps create friction in the line. You then flush with 3 milliliters of heparin. Also using the pulse pause technique. You would apply a new sterile cap to the line.
Hi, my name is Danielle. I'm a nursing student, and I'm going to show you how to do a central line dressing change.
First, the nurse will perform hand hygiene. Then apply a mask to the patient. And have them angle their head away from the nurse. The nurse will now put on her mask. And apply clean gloves. It is now time to remove the old dressing. The nurse will visually inspect the insertion site of the catheter for signs of infection, being careful not to touch the site with gloved hand. Now she will remove her clean gloves. Open sterile gloves and create a sterile field using sterile glove package. Open chlorhexidine swab and drop into sterile field. Open transparent or gauze dressing and drop into sterile field. Open skin prep and place on outer edge of sterile field. It is now time to put on the sterile gloves. Clean skin with the chlorhexidine. Pinching the sides to. Clean skin with chlorhexidine swab. Begin directly at the insertion site and move swab in a circular fashion without retracing the area already done. Use friction when cleaning the area. You will now have one unsterile hand. Then allow the chlorhexidine to dry for 1 to 2 minutes. Do not blow or fan the site. Now using the unsterile hand, pick up skin prep packet and remove skin prep pad with sterile hand. Apply skin prep on outer perimeter of skin where the dressing edge will touch the patient. Do not put skin prep over the catheter insertion site or the immediate surrounding area, and allow to completely dry. Apply transparent or gauze dressing per manufacturer recommendations. Central line dressing shall be changed every 7 days or when it becomes damp, loose, soiled, or if the patient develops problems at the site that require further inspection. Except for patients who have skin breakdown or oozing, an occlusive gauze dressing may be used and changed when soiled or every 24 hours. Gauze dressings may also be used for patients who do not tolerate a semi-permeable transparent dressing, and they are changed when soiled or every 48 hours. The nurse will apply the dressing and smooth out any wrinkles, starting from the center and moving outwards. Now remove gloves unless indicated by isolation policy.